Assalamualaikum. My name is Nurul Syahira binti Zaharudin and my matrix number is 2019468264.
My name is Nur Alia binti Shaifullizan and my number matric is 2019831704.
Hello, my name is Siti Khairunnisa binti Ramli and my matric number is 201986x256. Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Khairunnisa binti Ramli and today I would like to present about introduction. Mental health is a major public health problem all over the world. Thinking, emotion, learning and self-esteem all play a role in a person's mental health. Other than that, relation, emotion and personal well-being also can contribute to people's mental health. The World Health Organization defines mental health as a condition of well-being in which an individual recognizes their own capacity to cope with life stressors in a constructive and useful manner, as well as their potential to contribute to their community. This report was created because many people who suffer from mental disease are afraid to share their condition. Mental illness, on the other hand, is not anything to be ashamed of. Mental illness can be treated. Treatments are available to help patients manage mental health conditions more effectively. The first thing you should know if you have or feel you diagnosed with a mental illness is that you are not alone. People denial or fear of expressing mental illness difficulties make them far from common than you may think. You must remember that one little crack does not mean you are broken. It means you were put to the test and did not break apart.
Assalamualaikum. My name is Nurul Syahira binti Zaharudin. Okay, now let's talk about the mental health issues among youngsters. These issues have a significant impact on a lot of aspects of an adolescent's life, including their physical well-being, academic accomplishment, contentment with their college experience, quality of life, as well as their relationship with family members and friends. These issues can also have lengthy impacts on the student's health status, future career, and potential earnings. Several studies show that student mental health is rising year after year, especially during this pandemic of COVID-19. ODL, which is online distance learning, has led to many students complain of stress and tiredness because they have to spend time all day to study every subject they take in front of their laptops, mobile phones, tablets, and so on.
My name is Nur Alia binti Shaifullizan and this slide is about social problem. Usually mental health problem happen when social problem exists. Social problem like family problem is one of the reasons. Family bonds are important in everyone's life and they may offer a variety of feelings and experience. Emotional or physical abuse in the parent-child connection can lead to a serious mental health issue that require lifelong therapy. There are various forms of psychological abuse can do significant harm to children and making a young kid feel unwanted. Repeatedly rejecting their thought, mocking, criticizing them, screaming and displaying animosity make them feel very uncomfortable in their family and environment. There are numerous factors or reasons that leads to a social problem. One of the factors is financial problem. A financial problem can lead to a variety of issues in someone's life. Financial problem form extreme stress and may have a significant impact on your mental health and physical health, relationship and also well-being. It can also cause suffering and mood swing as well as create a pressure and argument with those closest to you, especially family and friends. The worst is when we cannot control our mental health is we maybe will let it out to our loved one.
Second social problem is work overload. Workplace stress can be caused by a variety of factors. For example, if a person's job responsibilities are greater than they can handle, they may feel under pressure. Workplace labor overload, on the other hand, can have a significant influence on mood, mental well-being and job performance. Emotional instability can damage relationships with co-workers, supervisors, friends and family. Thinking about one task can lead to anxiety and it can also lead to feeling inadequacy and low self-esteem. This is because when boss suggests speeding up. However, anxiety and feeling of powerlessness are common partners of depression. Next, the reason of work overload is long-term stress. Stress is a normal response to situational pressure or demands and is a part of everyday life. Long-term stress, on the other hand, can lead to mental health problems and psychological complications. When stress reaches too much and lasts too long, the chances of mental health and psychological problems rise. Long-term stress make the probability to get mental health issues like anxiety and depression, as well as drug abuse issue, sleep issues, discomfort, and physical system like muscular strain. That is why people who is suffering from this trauma is risking their life. It can be concluded that a long-term stress make our ability to pay attention, remember things, and cope with emotion are all affected.
Therefore, the social problem that has led to this issue is unemployment. Unemployment or a loss of a job may be a societal issue that affects our mental health. When someone stays unemployed for a long time, the impact on their mental health might become more severe and could lead to mental health disorders. One of the emotional impacts of unemployment is that people frequently feel as if they have no purpose in life. They will most likely to feel worthless or empty. One of the reasons why does these issues arise is because of low self-worth. Self-esteem refers to how we think and appreciate ourselves. It's based on our perceptions and assumptions about ourselves, which might be tough to change sometimes. Low self-worth may be developing among us every day. The message that you are not good enough is the one that sticks with you for some reason. Whatever has destroyed your self-esteem, it is important to remember that you have the right to be happy about who you are.
For this slide, I will talk about data and example cases. According to the head of Bukit Aman Criminal Investigation Department, they recorded 468 suicide cases during first 5 months of 2021, up from 631 incidents in 2020 and 609 for 2019. In Malaysia, Johor had the largest rate of suicide in 2019 as well as 2020, with 101 fatalities, with Selangor had the most number of cases in 2021 until May with 117 fatalities. Based on Ministry of Health survey, Code Blue revealed last year that suicidal behaviour had increased among Malaysian teenagers, with 10% of 13 years old attempting suicide. Teenage female had the greater of suicide behaviour than boys, with 10.8% expressing suicidal thought compared to 9.1% for boys. Next, 7.8% of female intended suicide compared to 6.8% of boys. However, boys are somehow more likely to attempt suicide more than girls.
The second data or example is on July 10, 2021, there is one tragedy, which is there is a university student died because of stress caused by having to attend online class and she stay up every day. The girl woke up at 3 a.m. and feeling not well, and then she was found unconscious at her rented property in Merbok at 4 a.m. and was transported to Sultan Abdul Halim Hospital, Sungai Petani for treatment, but she was pronounced dead.
And the last case is at Kuala Lumpur Karak Highway. On Tuesday, January 15, 2022, a video of 16-year-old teenager trying to jump from a flyover at kilometer 46 of Kuala Lumpur Karak Highway, Bukit Tinggi, was caught due to her depressions. This was thought to be linked to a high level of stress and despair. However, the girl was saved by the people around that place.
In this world, there is a person who has a narrative saying that mental health issue is too cliche, and even sadder when people around, including family members, put aside family members who are facing the situation because they feel ashamed. Thankfully, one with the mental health problem needs support from others. This is why there are so many facilities and agencies that can help those people who in need. The first is Mentari Malaysia. Mentari is a new method introduced by Ministry of Health Malaysia to increase outreach and reintegration of people with mental health problems. It is a new approach initiated by Ministry of Health to improve outreach and reintegration of people with mental health problems. Mentari Malaysia offers a variety of service to adult, elderly, and those who with disability. Treatment, care and rehabilitation provide a range of service for depression, anxiety, stress related to illness, psychosis, bipolar disorder, self-harm, dementia, and neurocognitive problem. Not only does Mentari Malaysia provide diagnosis and treatment, but it also preach out about mental health prevention and promotion, which is in line with the organisation goal of reducing stigma and prejudice among persons with mental health issues.
Next, we go to Hospital Ulu Kinta. Hospital Ulu Kinta is one of the government facilities that help people with mental health problems. This hospital also is the largest psychiatric center of the 4 psychiatric hospitals that exist in our country. This psychiatric hospital is the only hospital in Malaysia that has its own museum. A large part of the hospital area is used for patient activities such as agriculture, livestock and even fishing. Ulu Kinta Hospital offer treatments such as care, clinical treatment, psychology, education, counselling, moral and spiritual education for those with mental health. However, for patients who do not have serious mental health problems, there are workshops for both male and female patients. All of these activities have a treatment value termed as therapeutic to help the patient become covering. The staff at this hospital have high qualification, communication skill and think creatively and innovatively. They are always prepared to deal with patients whose behavior or reaction to a situation is unpredictable.
Last facilities provide is IF Psychosocial Rehabilitation Center. This facility is located in Petaling Jaya, Selangor. It is an excellent treatment facility for anxiety and depression and enduring mental health issue as well as addiction. They provide a caring and supportive enhancement from those suffering from mental illness, addiction or emotional disturbance.
Sometimes, stress can be difficult to deal on your own. When you are already having trouble dealing with stress alone, you can seek support and help from your friends or family. This is one of the tips to overcome mental health issue. Various studies show that a person will feel calmer, more comfortable and better and will be able to deal with stress when they spend more time with family and friends. Our nervous system is linked between emotion and facial expression. Therefore, when we are under stress, we will show a stress face. So, by smiling and laughing can help relieve some of the stress and problem you are having. By regularly socializing, you will also not feel lonely.
The second step to overcome mental health problem is by improving your lifestyle. People with depression tend to be reluctant to be active. Even so, you must strengthen the intention to start being active, such as exercising. The goal, of course, is to fight depression that you have. The reason is, exercise provides health benefits such as preventing heart disease, which is prone to occur due to severe stress. High intensity exercise can release endorphin that make you happier. Meanwhile, regular low intensity exercise can stimulate the release of nootropic protein. The presence of this protein can cause nerve cell to grow and make new connection so that brain function will increase. All of these effects make exercise such as powerful way to deal with depression. There are many different types of exercise for people with depression, including dancing, jogging, brisk walking, yoga or cycling. You can do this physical activity regularly, at least 30 minutes every day.
And the last step that we should take is to improve our diet. If you have eating problems due to depression, you should improve your diet as a powerful way to deal with this symptom. Keep eating on time and accordingly to your portions. Increase your intake of fruits, vegetables, whole grains, fish, and low-fat dairy products. You should also limit your consumption of high-fat and high-sugar foods as well as processed food.
Move on to the next slide is recommendation. Mental health is handled, managed and prioritized in various nations is radically different. In Germany, their government imposed financial support and extensive healthcare service. Germany has intensive in place to help people who has mental illness back to normal life after being treated in mental health facilities. Therefore, Malaysia can also follow the example of Germany by developing an organization that create employment opportunity for former mental patients. This can give huge impact to the patient because after they being treated at the facility, it can help them to become an independent and starting a new chapter of their life.
Korea has moving forward better than Malaysia. First, they have provide an anti-suicide phone at Mapo Bridge in Seoul. In general, helpline have three things in common, such as they provide 24 hours call 7 days a week. It is also don't cost you anything, and lastly, they are confidential. People are suffering from mental illness, they need people to talk to. So basically, if they tend to suicide, they can grab a call and talk to someone. Once they call, the center will connect with a nearby hospital, and then they will send a rescue team to help the victim. Other than that, the handrail contains motion sensor to detect people's motion and then display short inspiring words as well as photographs of happy families and individuals. This will make them think twice before they want suicide. Hence, we can equate between Han River and Jambatan Pulau Pinang.
And the next recommendation that we would like to suggest is such as in UNC Chapel Hill, Carolina, where they host eating disorder specific training as one of the approach to combat mental health illness among their people. This shows that a youth mental health first aid course is one approach that can be learned successfully and quickly. It is designed particularly for parents that engage with children on a daily basis. The training covers prevalent mental health issues that affect kids as well as typical teenage growth.
As a conclusion, mental health illness is prevalent and affect people from all walks of their life. However, by increasing the mental health awareness and early detection, it can help to lower the number of people who suffer from mental health issues. We need to learn that it is very important to love ourselves first before others. Filling our mind with positive thoughts can make us feel more relaxed when facing difficult situations and thus not choosing to hurt ourselves. Remember, one small crack does not mean you are broken.